The idea of the first session is for a client to be able to think about whether the therapist suits them. And it also gives the therapist a chance to think, have I got the skills, the expertise and the approach that's right for that client? So it's a bit of a two-way process. It can feel really daunting when you approach a therapist. Often we approach therapists if we're at a very difficult point in our lives, so that it can be a bit scary asking for some help. And it's really important that that gets acknowledged. I always try to say, I appreciate that this can be a difficult step. The most important things to realise in your first session is that it's really busy. There's lots and lots to kind of cram in, and often you might want to come into the first session as a client wanting to tell your story, and there's also lots of practical stuff that we need to get in as well. So it's trying to get that balance right between it being a really full session full of practical information, but also being able to tell your story. What you can expect is a bit of time taken for making sure you understand the contract. And often what happens is the therapist will check out that you understand certain aspects, such as the confidentiality limitations, issues around cancellations. They'll check out that you understand all of that and how notes are stored and who might contact you in the event of an emergency, which can feel quite overwhelming as a client because you get a lot of information. But it's really important that the therapist checks out your understanding of this, and it gives you a chance to ask anything. Now, often therapists will say you don't need to ask all your questions in that first session. Ask them at any point during the work, so you can always refer back to what you agreed in that first session. One of the questions I'll ask is, what brings you here? What is the thing that has been the catalyst for you to seek help? And that can be a really good place to start from, because often a client will know why they made that phone call or why they sent that email. So you can start from that bit, and then often the story will come out. It might be worth spending some time in your first session to have a look about whether you've got certain goals in therapy. How will you know that coming to therapy has made a difference for you? What will be the sign that something has changed? Will it be that you feel different about it? Will it be that you're doing something different? So it can be really important to focus on how will you know that it's been worth it. I would hope that a client goes away feeling satisfied that they've had a bit of time, and any really important questions that they had got answered, or they felt able to come back and ask those really important questions. So that's one of the things that I'd encourage clients to do. Do ask your therapist, ask about who they are, what they do, what their experience, how they approach the work. You need to know about them enough so that you can make an informed choice about the person you're going to work with, because it's a really important relationship to get right. Make sure it feels that you've got the right fit with that person, because that's the most important part about therapy, is that therapeutic relationship. And it's very hard to capture in words what that might feel like, but it's a sense of being able to be yourself and really do the work that you want to do, and your therapist will be able to hold you in that work in a therapeutic sense. If that therapist doesn't feel right for you, or if their approach doesn't feel right, it's absolutely okay to say thanks but no thanks. I think therapy is great. I think being able to access support that is outside of your family or your normal social circles, it can be really, really useful to have a therapeutic relationship that the focus is on you and your well-being and the things that will help you feel as well as you can.